Bonjour tout le monde. Good morning, everybody. So this morning is going fast. It's great. So much great content. It's a real pleasure to be here with you today. We have 45 minutes to talk about a very important topic. The money. Where is the money going to come from for all this fantastic work that you are talking about and identifying? So I will be very brief. Je vais passer tout de suite à la présentation.
I will go right away to the presentation of the panelists. I will invite them to join me here on the stage. I'll start with the Ambassador Marc-André Blanchard. Where is he? He's our ambassador or permanent representative to the UN. Welcome.
I'd like to invite George Patton, the chair of the Lancet Commission on Adolescent Health and Wellbeing, and also at the University of Melbourne in Australia. Welcome, George. Mariam Clayson, director of the Global Financing Facility. And finally, Emmanuel Capobianco, the Deputy Executive Director of Partnership for Maternal, Newborn and Child Health. Okay, so my microphone will follow me. Okay, welcome. Thank you. It's great to have you here this morning, as I was saying, to talk about a really crucial issue, which is how do we finance all these very important interventions that are being discussed yesterday and today, and that the community is so aware are key to moving the broader health agenda forward. So each of you is going to be invited to make some opening remarks, and I know a couple of you have, the clicker, which I was supposed to grab, and I didn't. Okay, so we have two, and who are the ones that have presentations? You do, and you do. Okay.
Thank you.
There you go. Okay, so we will start with opening remarks, and then we'll have a bit of an exchange here amongst ourselves, and then I'm hoping to reserve some time for the floor so that we can get a couple of incisive questions from the audience as well to round off our conversation. So we'll start with Ambassador Blanchard, please.
Thank you very much for having me. It's a pleasure to be here, and thanks for attending, and congratulations for organizing this important event. I had some notes that were prepared with my office, but it's too long, and it's the usual stuff of Global Affairs Canada that maybe I should talk about something else or add my own personal view on this. So I'll talk to you about I'll exchange. Last I arrived, as some of you know, I come from the private sector. I was a lawyer and a managing partner of a law firm in Canada before becoming the ambassador to the UN. When I arrived at the UN, Ban Ki-moon said to me, you know, Marc-André, you probably know a bit about financing, so you should pay attention to financing. If you could help us at the UN dealing with financing, then you know, it's all going to we need to focus on the implementation of the Agenda 2030, and could you help us? I came back from that meeting to the mission, and I said, you know, this is fantastic. The Secretary General wants me to, you know, focus on financing, help him on finance, all excited. And all of the people that are around me, and I said, you know, this is all about the private sector role. And they all looked at me in a state of shock, and they said, no. You can't talk about the private sector at the UN. It will be completely pushed back, and we're not ready for that yet. A year later, we started a group called the Group of Friends of the Financing of the SDGs, focusing, and the goal, if you're the Canadian ambassador, what do you have in your pockets? Yes, you have a phenomenal country with great resources, but you know, an active player traditionally with our development assistance. But you look at the needs are so big, and you look the needs, so we're talking about a $7 trillion gap in financing for the implementation of the Agenda 2030. When I looked at the amount of ODA worldwide, if you add all of the ODA, the development assistance by each country in the world, you get to $135 billion a year. And you need to find $7 trillion to implement the Agenda 2030, the 17 SDGs goal. So I said, where's the money? The money is not there. And then I started to scratch. And I found that actually the money is there. The money is in, in many places, but I'll give you 3 places. So private equity, insurance funds, pension funds, and if you're the Canadian ambassador, we know a bit about pension funds in Canada. So when coming from my little background, I had them as clients and stuff, so I know how they work. So I looked at it. If you look at these 3 buckets, each of them are north of $25 trillion each in assets in the world. So you have approximately 80 trillion sitting there. And I looked at it and I said, well, is it easier to get the 135 billion to 7 trillion a year, or is it easier to continue to work to 100 with the ODA and make sure that we actually leverage it to a point and use it as a catalyst to actually make sure that I get 10%, let's say just roughly, of that buckets of $80 trillion. And actually, like any other answers, it's not black or white, and it's a mix of everything. But we need to, so my goal with this group of friends is to unlock institutional money for the financing of the SDGs. And so we started a group of friends. And that's the vortex, the language of the UN that doesn't say anything. So it's like, so the group of friends of the SDGs, we started with 10, 15, 20, 40. We're now 60, close to 60 members in the group of friends, and I lead that with Jamaica, with the ambassador from Jamaica. And it was, you know what? It changed completely at the UN, what we're talking about. Like this, we're now discussing financial for development, and everybody, like the group of 77, China, Russia, everybody is raising the role of the private sector in all of this. And I'm saying what we found so far, and I'll finish on that because I can talk about an hour for this, but like you don't want that. But like it's actually what we found is there's a regulatory gap. So in countries like Canada, we'll have to look at our regulation to make sure there's no obstacle to investment in our rules and regulations and our policies of accounting and finance and all of that. The second place is the regulation, obviously, of the host countries. The second point of, so regulatory gap, the second thing, which is the most important for all of us today, I believe, is actually the asymmetry of information about what are the challenges. Like, look at Bill Gates. He gave a speech yesterday or the day before at a convocation, a graduation in class of 2017. And he said one thing that he, as an advice he gave to the students, he said, be aware of what's happening in the world. He said, I've learned, me, Bill Gates, and Melinda, we did it too late. And I was too late in my adult life. And you have to make a difference from the start. So people are not aware of the size of the challenges. You are, but the general population is not. The second, and it's particularly important now with populism and all of that, the second point is the asymmetry of information is about the risk. People think it's way riskier than it is really in some cases. And we need to have a global discussion about the risk. And so the third point is the issue of capability of deal flow and capability by countries. And we're working on that now at the UN with individual countries, and there are many organizations doing that. But this is the toughest part. You know that, those of you who are in the field, you know this is the toughest part. And this is where we all fail to a large extent. So this is what I had to say, and I'll welcome your questions. But I just say, we have to be creative. We have to think about how new ways to collaborate and actually to connect with unusual players. And we need to be creative because, oh yes, the point that I forgot is, to me, it's all about scale. We need to get scale in all of this. And that's the importance of it. If not, we won't get there. And that is so important. We need to stop thinking about it like the cottage industry in Canada. It's about scale and making this happen. And so thank you. Thank you
very much. Okay, thank you very much for those remarks. And I think scale, definitely, and focus. I really appreciate how you focused on 3 large sources of potential funding from the private sector. Very helpful. So now I'll invite George Patton to make his presentation.
Thank you very much, Julia. I'm going to link back to the session yesterday on data. because financing is actually about data of a different kind. It is about data on need. It's about data on what works. And it's data about how much that all is going to cost. And these are the kinds of data that we haven't necessarily had in the adolescent health space. If we look at other areas of health, look at women's health, look at the health of younger children, look at areas such as HIV, we actually know the answers to these questions in many of these fields. But in adolescent health, we haven't had the decades of investment in those data. And therein lies a real risk and a threat to us today as we try to take the global strategy forward. That if you come to ministries of finance, they're going to be looking at questions of what if we spend $1 are we going to get from it? And if we can't answer that question in terms of adolescent health, we are not going to get investments in adolescence. So there are 3 questions I'd like to address. Where should we be investing? What is the likely value of those investments? And thirdly, what is it going to cost us? I'm going to draw on the Lancet Commission report from 12 months ago and the global financing case that appeared in the Lancet 3 weeks ago, for those of you who haven't seen it. This was initiated by UNFPA, and it was conducted by colleagues at Victoria University in Australia. So what should we be investing in? Here's the conceptual framework from the Lancet Commission, and it sets out the universe of where investments should be made in adolescent health. Many of you know that in health we tend to look at health problems and what health systems can do. But investments in adolescent health need to go beyond that. They need to go to the risks that emerge during these years for health, that affect health during these years, but also across the life course. We need to invest in the structural and social determinants of health that also emerge during these years, gender norms as one example. We heard from the Deputy Secretary General yesterday that if we get the investments right, we get a triple dividend of reduced death and disability during the adolescent years, healthier trajectories across the life course, and because it's the next generation to parent, the healthiest possible start to life for the next generation. So where have we been investing? This is where we've been investing during the MDG era. HIV and sexual and reproductive health in terms of adolescence. But I want you to think for a moment about the sexual and reproductive health of a girl and what it is linked to in a girl's life. Well, it's linked to other things in health, nutrition, mental health, experiences of violence, infectious disease, education, cultural norms around early marriage. And this is where we need to move to. We need to move to a comprehensive investment case for adolescent health. So do we have investments that are good value? I'm going to introduce this next slide by talking about an indicator which is a benefit-cost ratio. Can I ask who knows what a benefit-cost ratio is? Let me tell you, it's something that ministries of finance pay a lot of attention to. And it's a monetary measure of the value you get from an investment. So a benefit-cost ratio of 1 means you get $1 back for every dollar you spend. A benefit-cost ratio of 2 means you get $2 back. Benefit-cost ratios of 2 are generally seen as very good investments if you're talking about things like roads or energy, infrastructure. So what are the benefit-cost ratios for 5 actions for adolescent health? Preventing child marriage, promoting secondary education, giving the HPV vaccine, preventing road traffic injury, and promoting sexual and reproductive health services. On the y-axis here, it's a logarithmic scale because I couldn't actually fit the benefit-cost ratios onto a linear scale. They're that big. So if we look at investments in health, in low-income countries, we have a benefit-cost ratio for the HPV vaccine of 20. That is an extraordinarily high BCR. If we're looking at sexual and reproductive health services, whether it's low-income, lower middle-income, upper middle-income countries, we're talking about benefit-cost ratios that are extremely good value. So too, if we look at the investments outside of health, looking at preventing road traffic injury, promoting quality education, preventing child marriage. We're talking about benefit-cost ratios between 6 and 10. These are as large as any of the investments you're going to get in health of younger children or in women's health. Investments in adolescent health are great. What's it going to cost us? Again, on log scales, in terms of these 5 investments, you'll see here that HPV vaccination is very cheap. An annual cost across low and middle income countries of under $1 billion. Still good value, but more expensive are investments in sexual and reproductive health services, quality education. How much are we spending? This is from Vegard Skebæk at the Norwegian Institute of Public Health, published only a few weeks ago, about where we are spending developmental assistance for health. You can see that the big investments are actually in the 0 to 5. If we look here at the 5 to 9s, 10 to 14s, 15 to 19, our developmental assistance for health falls off. It plummets. Rises again in adulthood, only to fall off again in old age. I'd like to map this against population for you to show you what that looks like. These are population numbers here across these age groups. You can see that in terms of developmental assistance for health, we're really missing the adolescent years and older children. If we look at those 2 kinds of investment, the health investments without education, 25 billion. So we're not talking 80 trillion here, 25 billion per annum across the least developed countries. That would be affordable if we scaled up developmental assistance for health to the levels we have in the 0 to 4-year-olds. If we actually look at education, including education, the costs are 86 billion per annum. This is entirely affordable. If we're looking in terms of GDP, that first figure of 25 billion is about 0.3% of GDP of low and low middle income countries, 1.3% if you include education. I'm going to finish with this slide of young Australians sitting on a gum tree. Just to remind us that investments here in health are also about investments in the positive attributes. Adolescence can be a magical time of life. It's a time where an individual acquires those assets, those capabilities that you take forward into life. We must remember that we're investing not only in prevention of problems or treating problems, we're also investing in that optimistic view of the future. Thank you.
Okay, so we'll turn to Marianne, and you're going to show us what this looks like in a real case, real world.
Yes, thank you very much. And I will follow up on the themes of the ambassador about unlocking, unleashing, and leveraging money for adolescents. Who thought that financing could be that exciting? Before we dig into this question around, let me see here, where the money is going to come from, I just want to remind us all that who we are actually caring for and concerned about. Think a moment at what you see in this picture, please. You see 2 mothers. What we want to make sure is that we think about how to close the equity gap, how we reach those that are left behind and hard to reach. A typical Bangladeshi girl will be married at 16, have had a child within the next year. In fact, 10% have kids, the first child before they reach 15. 42% of them are anemic, and a third of them are undernourished. How can we change this? So clearly, what we're talking about here is not business as usual. It's about transforming the way we finance for development and finance for adolescents. Because the great themes of this conference is mental health, sexual reproductive health and rights, and nutrition and data. These are 4 underinvested, neglected areas of work, seriously underinvested in. So how can we mobilize what we estimate is about 33 billion a year across the reproductive, maternal, newborn, child, and adolescent health agenda? We need 33 billion a year. We think it can be done, but then we have to transform how we finance for development. We have to be, as was said, both smart, scaled, and sustainable. That's what we think about. We already heard about how to be smart. George talked about smart investments. It's smart to invest in adolescent nutrition, sexual reproductive health and rights, and mental health. It's smart to do it in a way that's country-driven, so we can indeed think about scale and sustainability. And the way we see that this is going to happen is by focusing on the most critical periods in the life cycle, around birth, early years, and adolescence, to improve efficiency. I don't know how many of you know that even money that is allocated for the health sector, WHO has estimated that 20 to 40% of that money is not used. So how do we use the money that's there in the public sector? How do we mobilize domestic resources? They are there and can be mobilized for adolescent health and development. How do we align external financing, all that bilateral aid that's scattered across thematic areas, geographic areas? How can we align that around a few key targets related to the SDGs? How can we make sure that we link, in our case, global financing facility trust funds to concessional financing in low-income scenarios? And in fact, we know from the first 16 countries where we are now operational that you can link a small trust fund amount of $1 to $4 from concessional financing. And finally, what the ambassador talked about, the private sector, not just the private sector financing, but the solutions and the innovations that the private sector bring to us. If we bring this together, we can close that finance gap. Now you wonder, well, so what? What does it mean for those girls and for our target audiences? So as you said, I will give two examples of global financing facility, countries at the driver's seat sitting down and deciding what to do. Bangladesh, indeed, they decided that dropout rates among adolescent girls, the fact that so many don't complete secondary education, which of course is critical also for delaying early marriage and pregnancy, that they needed to engage both the education and the health sectors. And they defined three things that cause dropout among young girls: menstrual hygiene, undernutrition, and what they call emotional problems. And I think, listening to our previous speaker, this is about mental health and depression. And they decided that ensuring stipends so girls can stay in school separates a simple thing like having functional toilets for girls, here in a ratio of 1:50. Make sure that you bring in SRHR and gender equity in your curriculum, menstrual hygiene, not just in schools, but also reaching home, tackling bullying, adolescent health services, not just for students and teachers, but also in the community, peer counseling, nutrition services. So these are some of the very concrete areas of investment. Go to a completely different scenario, and I will finish with that, and that's Liberia, coming out of the Ebola crisis, thinking about resilience. There, the country wants to use the financing for reproductive, maternal, and newborn child health and nutrition to address both supply and demand factors, to ensure that there are, at the community level, what we heard about yesterday, social behavior change communication, changing social norms that condone sexual and gender-based violence, and that includes female genital mutilation, improve curricula, skilled antenatal, childbirth, postpartum care, also for young mothers, adolescent mothers, and then educating both boys and girls on topics of reproductive health and sexuality. So I think with transformational thinking around financing, and I want to close by also thanking Canada, the government of Canada, that's one of the founders of this new approach to development, financing for development, that we are trying to find a pathfinder for through the GFF, tackling adolescent, but also early years and birth. Thank you.
Thank you, Miriam. Thank you. So that helps us to very concretely visualize what impact this is having on the ground and why it's so important. So, Emmanuel, we're going to end this initial round with you, and I believe you're going to focus in on fragile states and tell us how we're going to crack that nut.
Thank you, Julia. And I would like to go back to the pictures of young adolescents, women that were presented by Natalia earlier today, because that's what we are talking. Financing for the Ranim, who is a Syrian refugee outside Syria, but also preventing death of our sisters that are still in Syria under chemical weapons that are being dropped on them. It's saving lives and protecting lives of adolescents in Somalia that are dying of hunger 20 years again after previous hunger in a cycle that is not interrupted. It is helping the lives of those adolescents who are in coastal areas that are going to be hit by hurricanes and more hurricanes because of climate change, or those ones that are standing and going and studying into facilities, schools that can collapse at an earthquake. So that's what we are talking about, is financing for these adolescents. And the first point is that we should invest more in prevention. We should invest more in disaster risk reduction. We should invest more in building resilience in systems, and we should invest in peace building. And all these three areas are areas that have come up as very critical nowadays. And there is greater investment on disaster risk reduction, with insurance schemes being brought forward by the World Bank being quite effective. We are seeing an increased amount of financing for building resilience systems for health and community systems, so that in DRC today, where we have an Ebola outbreak, we will not see again, hopefully, what we saw in West Africa a couple of years ago. We're also seeing an increased focus on peace building, and I think the new Secretary General has really put this at the core of his agenda for a good reason. But investing in prevention is not enough. We have a number of crises. We saw them in the map earlier in red that requires assistance. And it's a lot of money that is required. It's $25 billion. It's 12 times what it was 15 years ago. And we are not meeting that demand. The majority of funding is coming from ODA countries. There has been a positive increase in funding from the private sector, that now in private donations that account for 25% of the current financing for humanitarian assistance. There is positive signals from countries that were not engaged before, particularly in Islamic regions. So the Gulf states are waking up and putting more money into this, but it's not enough. And I will go back to what the ambassador mentioned earlier on the need of innovative financing, looking at levies like the airline taxes or taxes on financial transaction that can bring an enormous amount of money into the system. It's looking at ways to bring in partners that have been outside in financing this. We need to also change the way that we finance in countries and becoming more efficient. And there are some good examples. Afghanistan is one of those. Over the past 10 years, donors have come together in a multi-donor trust fund that has been quite effective in bringing down child mortality rates and maternal mortality rates, agreeing on a basic package of care where all the donors and all implementers provide services. Now, I was talking about financing in general, and then we need to go back to the adolescents and how you finance specifically for programs targeted at adolescents. And I think one of the important lines for humanitarian assistance is trying to keep the financing unearmarked and ideally multi-year. Coming in with very focused financing may backfire, particularly if the country is not ready, has not a culture of certain interventions that are being pushed into. So we need to be very sensitive to the local reality. And one of the biggest problems we have in financing in the humanitarian field is the money doesn't go to the local actor on the ground. Local NGOs get 1 or less than 1% of the total financing for humanitarian assistance. And the local NGOs are the ones who know what is needed at the country level during an emergency. More importantly, money needs to go to the people that need it the most. And I think one of the biggest outcomes of the World Humanitarian Summit that was held last year in Turkey is a big push towards cash transfers, where money is provided to women and adolescents that actually can use that money to protect themselves and to fill the needs that they have. So that is, for me, the key message: investing in prevention, trying to look at innovative way of financing, and lastly, trying to really go down to the people and provide the financing to the people that need it the most. Thank you.
Okay, thank you very much. So lots of really interesting challenges that you have all kind of signaled to or pointed to in your remarks, but also some definite avenues for moving this agenda forward. So I wanted to pick up on something that you mentioned, Emmanuel, at the end. So when this session was put together, we were asked to have in the background the ambition of securing equitable, gender-responsive investments for adolescent health. So it's not just investments, and you alluded to that in your remarks. We have to do development different, and we have to finance it differently. So it's like a double challenge, at least, because we know that moving to more equitable, gender-responsive activities and development programming and investments makes it more expensive. It's not going to be equally, as economical or cheap. So the challenges of scale that were mentioned by several of you, the great gap that we have, and the new ambitions that we have with the SDGs of how we want to do things differently. We want to take things to a deeper level, more sustainable, more equitable. So all of that is generating huge challenges on how we're going to finance this very ambitious agenda. So I wanted to circle back to a couple of things, and I do want to make sure that we do hear from some people on the floor. So if you're keen to jump into this conversation, start maybe making your way to the microphones on the floor. So I wanted to go back to your remarks, Ambassador, around the private sector. I really appreciate it. I find that often this whole conversation, so the reaction that you felt when you arrived at the UN and everybody said, no, let's not talk about that, is in part, if not in large part, due to the fact that the term private sector kind of seems to mean everything and different things to different people, and that's where some of the confusion and apprehension, I think, comes. I think it's not uncommon for people to associate that term to private firms, right? Multinational firms, the Unilevers of the world that have a role, and some of you talked about the important innovation role and solutions finding role. But when we're talking about financing and closing this gap, I really appreciate the fact that you said there are 3 buckets here where there's a lot of money that could be invested. Right? But as a follow-up question to you, is it clear to you where that money can be used and put to good use, and where there's a space where we still need ODA? Is there a difference, or are these fungible? Like, is the same money that comes from these 3 pools usable? Can we use that in the same way that we would use ODA funds, or is there a specific area for ODA financing that is still present, necessary, and therefore we need to also be talking about ODA, right? So I would start maybe asking you, and then maybe I'll turn to others who want to jump in on that. Mm-hmm.
ODA is essential. I mean, there's no doubt, and we should all work to increase ODA where we can. The issue is just, for example, for me, the ODA must be focused for sure on the poorest and the most vulnerable, and as a mean, that's the part of leveraging multiple dollars from private sources for each dollar spent. You look at, there are some examples that are here in the room. I don't know if Peter Singh is still here, but Grand Challenges Canada is an excellent example, and then the Global Health Investment Fund, which is a fund of 108 million, in which, Global Challenge Canada invested, is also a good one. So they are interested in products that will have a clear impact on public health in developing countries, but they also have value in high-income countries. So for me, there's a part, of course, don't get me, ODA is key, is essential, it has its role, but I'm saying, yes, we should spend a lot, but let's be realistic as well. In the political environment and the fiscal environment that the OECD countries are facing, and the lack of global growth, it makes that battle very difficult to make to increase ODA. On the other hand, I'm telling you, there's a way bigger pot of money that we should pay way more attention to that we have had in the past. And it's actually, you know, in that pot of money, you have high net worth individuals. So, like Bill Gates has transformed some areas of humanitarian and development work but there are others. High net worth individuals are easier for some of the stuff. Then you have, of course, pension funds. They're not in the business of charity, so they're in the business of making returns for pensioners. But they are willing to take, you know, to accept a reasonable risk for long-term returns. Like, just think about what was done recently in Turkey. It's a project of multi-hospitals. The total cost of it is around 20 billion, and with the help of MIGA and EBRD, there's been up to now, I think, between 2 and 5 billion that has been disbursed, and the project is going on, and many hospitals are being built. And it's through, you know, there's some public money, some de-risking, and a lot of private sector money. That's what you need to, how you need to leverage it. We need to be better at leveraging it and collaborating and partnering, and don't underestimate. We have to put pressure in Canada. I'm going to continue to put pressure on our pension funds. We need to tell the stories of the needs. Remember, there's an asymmetry of information about the challenges, and that's important, and we all have a role to play to them, to inform them about the challenges. Then is to really have a global discussion on the risk, and then it's my last point that I just wanted to make on this is the opportunities. Like, pension funds they're not in the business, they have not focused on Africa, they have not focused really on Latin America or Southeast Asia. They're starting, and they will they do humanitarian stuff at first? No. But we cannot say, because they won't do that, we cannot say that they shouldn't be part of the game, because a lot of the things they could help with gender parity, to attain gender parity in some areas of the world. Then that could, you know, have ripple effect to early and child marriage, and that could help by just bridging the gender gap. You get 27 trillion in the economy globally. So you could do a lot of things there. So when you think about private sector, just don't think only pension funds. It's the whole gamut of things. And yes, of course, development assistance should remain a catalyst and should be there for the most vulnerable and the most fragile.
Thank you. So you've identified the catalyst role that ODA can play. Would you like to jump in with other ideas about how these complement each other? What is the role? Is it separate? Is it together?
No, I think this is a very central question, and I think at the heart of all of this is agreement around results. It's government-driven processes where you identify the highest priorities, and you get partners, whether they come from the private sector, ODA, or from your own domestic resource allocation, to actually focus on a common set of results. So it's prioritizing and it's results. And of course, it's engaging the private sector around not just, you know, really purchasing for performance, expecting results to be achieved with those money. So it's a new way of engaging as well with the private sector.
I'm going to turn to you, George, but I wanted to tweak the question a little bit. I mean, you can bring that in as well. Yeah. When you were talking about your the cost-benefit analysis, you did, I think, have, you know, the finance ministry in mind, you know, as your interlocutor when you're making the case. So I wanted to ask you how, you know, can we use that same case, I mean, that comes from the private sector? Do we have to make a slightly different case to private sector funds to invest? Same cost-benefit analysis work for both? Just your comments on that.
Well, I think in terms of overseas development assistance, which is where I was actually going to come in, I wanted to take the example of education as the kind of investment that is probably the best investment we can actually make in adolescent health, quality education. But there's a challenge in that for countries, because it costs countries, it costs families, it costs communities before you actually get a return on that investment. And overseas development assistance is going to be really important in terms of getting over that hump. And in relation to that, I wanted to pick up another sort of aspect that we need to get right, which Mariam has talked about, which is that to get education right, you've got to get a number of other things right. You've got to get policies around child marriage right. You've got to get policies around health. So Sanitation, menstrual hygiene, mental health, these are all barriers to education. It's very difficult sort of in many countries because they are funded in different ways. So health is financed over here, education is financed over here. Nobody is actually funding the interface, and yet it's in the interface where the real gain lies. And that's something where I think in terms of overseas development aid, this makes a huge difference because that's not going to be funded in country. So I haven't quite answered your question, but that's the point I think I wanted to make.
Okay, thank you. And just to go back to my question about the Ministry of Finance, because we're all, involved in these conversations with our Ministry of Finance, the cost-benefit analysis can also help them to decide what they fund, right? So is it health? Is it education? So we're making these different, return on investment cases, and the danger there potentially, especially when we have a low level of ODA, like the case in Canada right now, is that they will pick and choose and miss out on that very crucial, integral aspect of this. So any comments on that?
Can I just come and say yes?
Sorry.
Look, it's a package. Everything that we know about what works for adolescents, that's the point I was making. It's not as if the sexual and reproductive health of a girl is not linked to everything else that's happening in that girl's life. So we need to be investing in the things that are affecting development more broadly. And that means that we need to be investing in a joined-up approach. So getting child marriage policy right, preventing child marriage, is going to be essential to keeping girls in school. We need to provide quality education. That's going to improve health. But to provide quality education, we've got to make sure that you have good teachers, that you have good sanitation. Those are the kinds of things that need to be tied up into a package. If we don't get that right, if we simply invest, for example, in menstrual hygiene without actually the other components, we're not going to be effective.
Mm-hmm. Thank you. And just before we go to the floor, so the areas that you were talking about, so the fragile context, the most left behind or potentially vulnerable to be left behind, this resonates a lot in Canada these days. We have a new policy that's due to come out any day now where we already know, we've had some sneak previews that we will be seeing an emphasis on the most marginalized, fragile states, women and girls. So there's obviously a need for global leadership on that, an opportunity for Canada to play a leadership role. Any thoughts on where the Canadian government, civil society, academics in this room can push this agenda forward?
I've seen the leadership of Canada over the years, and I've really welcomed the renewed leadership on the humanitarian areas. We need more Canada. We need more Canadas outside Canada to follow the example. I think where I would put my emphasis is looking at where we can bring in innovation in a flexible way, even in this context. Canada hosted the replenishment of the Global Fund a few months ago. I think that is a smart investment. The Global Fund is out to provide services also in financing for against HIV, TB and malaria, also in quite fragile countries. That is something that has proven to be effective through mechanisms that has brought in those high net worth individuals, that has brought in private foundations, and has been able to bring a difference. There are examples, even in fragile states, of innovations. Think about polio. We are on the verge of eradicating polio from the world. The last cases remain in Afghanistan, in the places that have been most difficult, but we are being able to make an enormous progress. So it's an area where there is a lot to be done, with priority, looking at what is working innovatively, and pushing the boundaries.
Thank you. Okay, lots of people who want to speak, but we don't have a lot of time. So I'm going to ask you to be really brief. I think we all want to hear, what are you guys thinking about this conversation out there? So I do want to give each one of you a chance to just very quickly put out there what's on your mind, what question you have or comment, very, very quickly. And then we'll quickly give each one of our panelists seconds to wrap up and be inspired by your questions. So we'll start over there.
Hello. Hello, my name is Bethel Klilu, and I'm with the Conference Youth Council. Monsieur Blanchard, you said that Bill Gates was too late and decided to engage in addressing global health issues later.
No, he was saying.
Oh, he said, yes, that he engaged in global health issues later in life. So for the most part, adults drive the agenda for financing adolescent health, which includes the requirements for many grants. Practically, how can adolescents engage, especially when it's hard to meaningfully engage outside of volunteerism, and especially since most adolescents don't have a great deal of financial capacity?
Okay, thank you very much. Faster than that. Next.
Thank you. I'm Patrick. Just going straight, I just wanted to find out from the panel what their thoughts are and possibly what are the existing mechanisms in terms of how young people, especially at country level, could be supported in budget advocacy and accountability to be able to track spending for existing resources. And then also looking at the depreciating of the financing for reproductive health and talking through innovative financing strategies. How do we best synergize already existing funding schemes, like, for example, Gavi, Global Fund, GFF for adolescent health funding? Thank you.
Okay, thank you. I'll go over here.
So in the puzzle that we saw that nutrition, education, early marriage, mental health are all influenced by people outside adolescence. And actually some of these behaviors are carried out by parents, mothers-in-laws, grandmothers, and so on. How are we financing these people, bringing these people in? Mariam talks about changing social norms, and I think it's important, but we have to see who are the target groups that we need to work with. Policies and so on that we have talked about actually do exist in some of these countries, and yet the change is not happening. So how can we bring about effective change in these areas? And secondly, with the cost benefit analysis that was done, with the nutrition, I didn't see that appear. And so my question is, with the high return on investment for nutrition, where does it play in there? And is it just because there was no data?
Okay, thank you. Steve.
Hi, Steve Mason with Aga Khan Foundation Canada. I'm wondering, with the growth of sort of middle class and high net worth individuals in the global south, it raises the prospect of much more local indigenous philanthropy to support the achievement of the SDGs and adolescent health more specifically. So I was wondering, probably from perhaps Miriam or the ambassador, whether we're seeing promising new approaches to incentivize local philanthropy and also to make its direction flow towards core priorities.
Thank you.
UNFPA, 2 comments. On the financing with private sector, I think we have 2 very big challenges. One is on expectations, theirs and ours. They have much more of concrete expectations on returns, and they also are not so willing to work on the rights issue. So that's an obstacle that we need to come over. The other thing I wanted to say and challenge maybe George's jigsaw puzzle picture there. I appreciate the data and financing, because what we are not able to measure is actually what, in their full content, has been the effect of putting that emphasis to SRH in terms of mental health, in terms of child marriage, because they are not so separate as in the jigsaw puzzle. So I just wanted to say that. Thank you.
Thank you.
Financing adolescent health is a complex thing, and we agreed that we had to think outside the box, and we have 3 buckets of money sitting there: private sector, the bank, and also from ODA. But perhaps we are not looking at the emerging South-South partnership and opportunities of funding between the Global South. Global South partnership is no more a political cliche. This is really happening. Yeah. Countries like China, countries like India, countries like Indonesia, South Africa, just to give a few names. When Bangladesh sent 50 doctors and $1 million worth of medicine to Nepal, that is not counted as ODA. We may look at ODA in a different way. The services, the commodities, and the services provided by non-ODA countries are not accounted. That accounting has to be looked at in a creative way. So my message is that South-South partnership is a new way to look at the extremely needed, not necessarily the bucket of money, resources in terms of capacity, services, and commodities. Thank you.
Thank you. Okay. So I'm going to take 2 more here. Yep.
Okay.
Public sector financing and private financing are ultimately aimed at different purposes. On the public side, it's about efficient use of tax dollars to deliver public goods, and with private financing, it's ultimately about profit maximization. Within public financing, in the development sector, we've had 50 years of lessons learned the hard way in terms of how to deliver those services in an integrated way from a rights-based approach. If you're talking about unlocking those trillions of dollars, where that reconciliation, so you talked about a project in Turkey to build so many hospitals, that's almost where we were many years ago. Hospitals need staff, they need fair wages for those staff, they need sustainable supplies. So that reconciliation and the fundamental purpose of those dollars, how do you bring those two together, or can you?
Thank you, Amanda. And the last question.
My name's Aiden. I'm from the Youth Coalition for Sexual and Reproductive Health Rights. So my question is, how do we budget for advocacy? We've talked about having the benefit cost analysis, but in cases of advocacy, those are not very clear and they're not readily available. So especially for a country like Canada, how do we budget for advocacy where we can't show so easily the impacts in short term?
Okay, thank you very much. Wow, so a whole bunch of really interesting questions. I will let you pick and choose, and I apologize to everybody in advance because I'm sure we won't be able to address all of them fully, but I'll give each one of you a couple of minutes just to wrap up and address the ones that you feel are more relevant for you. So several questions on access by youth organizations, by youth on the ground. Then somebody said, and what about the others, the non-youth, who are also part of this picture? How do we involve them? Questions about nutrition and advocacy on the cost-benefit analysis front, question about philanthropy, questions about expectations from the private sector and our expectations of the private sector, how they deal with the rights agenda or don't deal with the rights agenda, and then I link that to Amanda's question around development best practice. What we have learned as a development community, how does that come together with the private sector coming into play a significant role? Then the question or the comment on South-South cooperation as well. So we'll start with you.
Great, love to pick and choose here. Many great comments, and I think we're talking about financing here, but the greatest asset we have is, of course, human capital. It is young people who are engaged. So in what way can we do that and ensure that, nothing for me without me? So I think very important to involve adolescents and youth both in the shaping of these national plans, these investment cases at the country level, because it's not just about cost effectiveness analysis, but what's feasible, affordable and appropriate. Making sure that youth take on the accountability function, keeping us accountable. And of course, that's why we need to get better at monitoring of results, identifying results, monitoring and evaluation. Track spending, as was mentioned, is a very difficult thing to do. So we are really working to get better at that. How do we at country level do that? Of course, as been mentioned here, a focus on making lives better for adolescents and their roles in the future involves the whole society. So let's make sure that we are thinking across the life course and tap into that. So many, many important points were made here, and maybe I should just stop that. Of course, nutrition interventions are part of the high-impact best buys, particular the nutritional status of young women, and that's, of course, part of what we are discussing here.
Thank you, Mariam. George?
I'll take three. Firstly, the question of young advocates and actually being resourced. This is something we've really neglected. This is a job. This takes time. There are expenses associated with it. We have not invested in those processes for financing young advocates doing the job. We've not invested in the platforms and the processes they need to have their voices heard. And that's true at a global level, right down to a local level. We're seeing signs of change. I saw Kat Shaverson here. So I think the initiatives around Women Deliver, I think the initiatives from the partnership are terrific. But we've got a long way further to go in terms of investing in young people to be able to hear your voice. Second point, some of these neglected areas around social norms. Let me just mention mental health. Do you know what the developmental proportion of the developmental assistance for health goes to mental health? 0.3%. These areas are hugely neglected, but as Vikram Patel said, we have effective actions. And if you actually look at the benefit cost ratios here, we're looking at benefit cost ratios of about 6. For every dollar you spend, you get 6 back from investments in adolescent mental health. So these are really important neglected areas. And lastly, a neglected area, nutrition. This is crazy. Zulfikar Bhutto was talking about sensitive periods. Adolescence is a sensitive period in two senses. One, if you, as a girl or a boy, miss your pubertal growth spurt, you will end up as a stunted adult. So in terms of your own life course, it's a critical period for nutrition. But it's also a critical period in terms of you and your offspring, because what happens in that preconception window, and we think it's about 8 years, that preconception window, where you need good nutrition. If you miss that, then your offspring has a higher chance of being stunted from early life. So nutrition we've neglected. We've failed in nutrition. We need to do better in that area.
It would take, what I want to say, it could take a long time to answer all of the questions, and there's no perfect answer to anyone. The idea here is just to make sure there's a bigger pie of resources available. The needs are big. The urgency to act is clear. So we need, if we keep doing the same thing, we won't get there. We need new resources in the pool to actually reallocate the resources around. So for example, it's not a choice or anything like that. The example of the Turkish hospital, if the Turkish government doesn't need to invest to pay for the brick and mortars of the hospital, theoretically speaking, it gives it more resources to spend on the care and what's needed to provide the services to the population. That's one example. And I just want to underline the fact that we need to work, like the comment made about the South-South partnership and the local issue that was mentioned. I just arrived from Haiti, from a 3-day visit in Haiti. We need to work with the government of Haiti and within their priorities and come in, and we need to leverage the resources we put in Haiti better than we've been doing in the past, because it's quite something to move from purely humanitarian security to more now of the development side. And I'm not saying that, don't misquote me. I'm not believing that the private sector is the answer to anything. It's one tool that we should enhance in the basket to give us more resources, to free resources, to do other things where there are market failures, and we will always need public money to invest there. That's the only point I have. So thank you.
And last but not least,
I would say that besides trying to increase the size of this basket to have a bigger pile of resources, we need to be more careful on how these finances are being used and spent. And the way to do so is by empowering countries and the people within countries, so that the programs that are finance are programs that respond to the real needs. And that's why the GFF moving into countries to develop an investment case, bringing all partners together as an enormous potential to respond to the needs with financing that comes from other parts, but to respond to the needs of the people. I would also like to make a plea on data. And of course, talking about humanitarian, this is an area where we lack data, and without data you cannot actually inform policies. Without data you don't bring in accountability, and without that it's difficult to bring in more financing. So there is a huge agenda of investing in data, in results, and using this for policy making and for increasing the financing. And that is, I think, at the core of what all of us should be doing around the area of adolescence, whether it is in a high-income country, middle-income countries, or a low-income countries, knowing, and this is my last point about fragile settings, that even in the most fragile of context, people have capacity, people understand what they need, and we should not use paternalistic approaches that have been used in the past. We should give them full power to decide how to use the finances that we can help raise for them. Thank you.
Thank you, Emmanuel. That's a great way to end the panel. Thank you.